Could you please briefly introduce yourselves and tell us about your current roles and missions at Journal of Health Administration Education and AUPHA?
Sure. I'll go first. Okay. I'm Nancy Borkowski, and I'm looking at, of course, my Hollywood Squares box here, and it's wonderful to say, you know what? I think I know about half the people on this call. Anyway, I'm thrilled to be here. I'm a distinguished professor at the University of Alabama at Birmingham. I'm entering very soon, next month, my second year as the editor for the Journal of Health Administration Education, which is published by AUPHA, which you'll hear from Dan in just a moment. In addition, I am also the chair of the Healthcare Management Research track for EURM, which is the European Academy of Management. Maybe some of you are going to the conference in the mid part of June. That is the healthcare management track is under the special interest group of public and nonprofit management. And let's see here, I'm also a fellow for both the American College of Healthcare Executives and the Healthcare Financial Management Association. So, because I was a practitioner before I went into academia full time, so I like to make sure that I keep, one foot in both worlds. Okay, so we know what's going on, and I am just so happy to be here today. So again, thank you very much for the invitation.
Thank you, Nancy, for joining.
Mm-hmm.
And Dan, would you please tell us about yourself and also AUPHA?
We can't hear you, Dan. We can't hear you.
Maybe Dan's earbuds are not working.
I
Okay.
know. Well, while he's working on his technology issue,
Yeah.
I didn't really tell you about the Journal of Health Administration Education for those who may not be familiar with it, but this is the official publication of AUPHA. And our focus for this journal is health management and health policy education, both nationally and internationally. So this is this is 100% of what this journal does. And we've expanded most recently various some types of submissions that can come into the journal, whether it's original research, case reports, teaching tools and techniques, and so forth. So if you're not familiar with it, if you just go on to AUPHA's website, and just click on publications, you'll see all the information about the journal. Okay. Dan, do we get our technology issues handled?
I don't know, did we?
Yes, we did.
Yes, we did. Good. Sometimes if you just go out and come back in, that's fantastic. Well, it's a pleasure to be with all of you, a real honor. And I want to thank Ferhat and all of you for asking me to join you today. It's especially a treat to be here with the editor of the Journal of Health Administration Education, fairly new appointment for Nancy, although Nancy has distinguished herself so much with AUPHA and other organizations. Nancy's also a past board member of AUPHA, past treasurer, and along with Dr. Hernandez, one of the recipients of the Filerman Prize for Healthcare Management Education Leadership, which is the highest distinction in the US and Canada for healthcare management education. And so, Ferhat, thanks so much for joining me. I'm really excited to hear that there are doctoral students here as well. That's one of the things I'm most proud about for AUPHA, that since about 5 years ago, when we put more of an emphasis on doctoral students and doctoral programs, we have over 1,500 doctoral student members of AUPHA now, which is really exciting. I also want to recognize that AUPHA is a formal sponsor of AOM. and the Healthcare Management Division in particular. We sponsor the 2 student awards each year and have for a very long time. And I look forward to seeing everyone in Philly, anyone who's coming end of this August. I'm Dan Gentry. I'm in my 7th year as president and CEO of AUPHA, the Association of University Programs in Health Administration, founded in 1948, primarily by the American Hospital Association and the American College of Healthcare organizations, with funding from the Kellogg Foundation. And so we recently, I guess 3 or 4 years ago, celebrated our 75th anniversary. And we are now 265 strong. So 265 bachelor's, master's, and doctoral programs, still primarily an emphasis on North America. The board's made that decision over and over again. We are not out to compete with our colleagues at SHAPE in Southeast Asia and Australia and New Zealand, or our great colleagues at EMA in Europe, but we're welcoming of anyone. And so there's a membership category that we can talk about, international in particular, that's very affordable, but we're still primarily focused on the US and Canada. I've been in the roles almost 6.5 years. I was an academic like many of you for 26 years. After doing my training at the College of Charleston, the Medical University of South Carolina, and then finally at the University of California at Berkeley for my PhD work. And I was on the faculty at St. Louis University, Rush University Medical Center in Chicago. And then I went to the University of Memphis to launch a new school of public health, and then finished my academic career before this job at the University of Iowa. And I look forward to our discussion today. Thank you.
Thank you, Dan. Also, that's a very informative introduction to AUPHA. That was going to be one of my questions at the end about like how the affiliation with AUPHA works. But you kind of answered a little bit, but we may dive into it if we have more time.
Yeah.
So my second question is, health administration education is changing rapidly. And as an educator and leader, what major trends do you believe will shape the next 5 to 10 years of healthcare management education?
Okay. Dan, if you don't mind, I'd like to go first and kind of talk about from a retrospective standpoint, trends, okay? And then you can take it from the perspective, okay, of what we see happening going forward in the future. So I wanted to talk about the trends that we have seen. One of the things that I did was, I don't know if I could say coerced or commissioned, okay, Ferhat and his research group to actually take a look at the journal in regard to health administration education over 4 decades. So from 1983 until midpoint of 2025, we were able to get a really good sense of what were the topics and are those topics continuing and so forth. So I'm going to just give you a little bit of information from the research that they did. For everyone, this paper is considered a special contribution to the journal, and it will be published in our next issue, which will be coming out the latter part of June, early part of July at the absolute latest. But just to kind of give you a little bit of a hint as to that type of the information that you would find in that article. There are trends, of course, that we see that are very impactful at that moment, okay? And I don't think anybody would disagree right now. AI is like on everybody's radar, okay? As far as not just in academia, but also in practice, okay? And how we're trying to integrate this now into our lives. But what we've also seen is for health administration education, there are long-term trends. One of the biggest trends that we have seen is in regard to competency-based education. How do we develop that within our programs? How do we assess it? I mean, that is always an ongoing conversation when program directors get together, whether we're talking about undergraduate students or graduate students. Accreditation, of course, is always a hot issue. We're always getting articles related to that. in some of the other areas are postgraduate fellowships. And I'd love to hear, whether that is something that is also being done with our European colleagues in their programs. And then digital skills is another area that faculty are focusing in on. And then also in regard to simulations, and again, just how do we teach with our students, and how best are they learning the content that we're trying to do? And since simulation and gamification has always been, always been of interest to educators in our field, we will be having a special issue in the journal that will be coming out early part of September. Again, just bringing us up to date in regard to what are we doing across the country in regard to our programs, whether it be graduate or undergraduate, in using simulations in the classroom. So these are just some of the trends, some of the topics. We have the hot topic of AI. We did a special issue last year on it. We're doing another special issue that will also be the first issue of 2027. So we'll have an update from what we did in 2025 on that. And but again, we're always talking about competencies, advisory, how do we engage practice in regard to the teaching of our students. So I'm going to hand it over to Dan, and Dan can talk a little bit about how AUPHA keeps us up to date on those trends.
Thank you, Nancy. So as part of AUPHA's last strategic plan, and this was 2020 through 2025, we're revealing next week the new AUPHA 2030 strategic plan with 2 new priorities. But in 2020, I think we probably sought to have the most ambitious strategic plan ever. Nancy was part of the board at that time. And so what we do now is we have what's called the AUPHA Body of Knowledge and Curriculum Guidance. It's up to 27 domains. It was always things like management and leadership and strategy and finance. The 2 newest domains are AI, digital health and technology, machine learning, and climate health and sustainability. So it's constantly changing. The nice thing is that it had not been updated in 2020 for about a decade. And now it's updated every other year, which is a big lift, but I think it's worth it. And those domains are co-led by all of our volunteers. I call the AUPHA membership our brain trust. We have a very small staff at AUPHA. There are 8 of us. I'm the only health management and policy person. Everyone else is association person, association management, finances, education. So we update the body of knowledge and curriculum guidance every other year. And then in the alternative years, we commission what's called the Environmental Scan and Trends Report, and very excited about the newest one of those. It will be featured in San Diego at our Patello lecture. Our meeting starts 2 weeks from today. Very exciting. We'll all be there for about 3 days. And that lecture will feature colleagues from UAB, NYU, Georgetown, Indiana, Georgia Tech, and a lot of other institutions. We were fortunate to have the resources to do both the more quantitative environmental scan and trends report that we do every other year. And that's headed up by a team from NYU. And then Jacob Victory heads that team. And then Daniel Kim at Georgetown wrote an incredible proposal. We got 14 proposals, and I would have liked to have accepted half of them, but we did accept 2 of them. And so Daniel led a team that has done more qualitative interviews. And I'm happy to share with you, Ferhat, some of what those highlights are here. So for the Environmental Scan and Trends Report, it's 2 parts. It's the health industry. And again, the focus is primarily the US and Canada. But I think that a lot of this applies. I mean, for example, one of the things on the list is population health. And I see so much work going on in Europe and other parts of the world on population health and population management. The other half of the report is on higher education, which is incredibly important. We are at a crossroads. And in fact, that's what the Patello lecture is called. at a crossroads. Do we move forward? Or are we going to be in peril? And I think that's up to us. And Nancy talked about some of this, about the financial pressures, the pressure for additional modalities. We really need to meet students where they are, not necessarily where the faculty has been and where institutions have been, whether that's still face-to-face, fully online, or in some sort of hybrid modality. But the top of the things for health industry in the newest report, and it just came out about 6 weeks ago, healthcare workforce, huge challenge. We're going to have shortages of everything in the US. It's almost like the perfect storm. We had this dip in the birth rate in 2007 to 2010. We've never recovered. We call it the demographic cliff. We had the largest group of high school students coming into undergraduate bachelor's programs last fall. It will never be that big again, at least not for the next 25 or 30 years. We've got lower immigration rates, legal immigration as well, than we've ever had before, which I don't think is smart and not very strategic. And then we've got growing needs. I'm at the tail end of the baby boomers, and we've been retiring now for almost 10 years. And we have high expectations about quality of care, and it's not where it's supposed to be. So healthcare workforce, coverage and access, big changes to Medicaid that have come out of some legislation passed in the US last year. As I said, financing across the continuum. With that aging, it's also long-term care, senior services, regulatory, legal, and compliance challenges. Things are very complicated. Our health systems deal with not only federal compliance and regulations, but state compliance and regulations as well. I think the integration of behavioral health is incredibly important. We've seen big upticks in substance abuse, mental health issues because of things like politics and the economic pressures and the COVID pandemic. And there's a fallout from all of that we're seeing. And so those are I think, some of the big topics. There were, I think, about a dozen or so subheadings within that for this most recent report. And then I'd be happy at some point to talk about the other half of the report, which are the challenges in higher education as well.
That was an amazing summary. So my next question is, by looking at your answer, so we're going to experience workforce shortages and everything. And when we're thinking that, my question may not make sense when we're going to experience workforce shortages. But if I ask you, what skills, from your perspective, what skills are currently missing most among healthcare management graduates entering the workforce? This is beyond the shortage. Is there anything that we are missing in their competency?
Well, I wouldn't say we're missing from a technical standpoint. I think everyone does a really, really good job as far as that's concerned. My concern is always around the soft skills in regard to critical thinking, communications, interpersonal relationships, and especially with this group that went through COVID, okay, that kind of lost years in regard to how do you develop those skills. It's going to be catch up as far as they're concerned. And they're so reliant on technology. I mean, I think we all have seen this where, you'd have four people sitting around a dining room table and everybody's on their phone, and you're like, why aren't we having a conversation with one another across the table versus just texting? And, and especially in healthcare, I mean, we're a people business. We work in teams. Very rarely are we doing any project on our own. And we really, I believe the students really need to develop those interpersonal relationships, and how do you communicate? How another soft skill is also, how are you a successful change agent? With all the things that Dan has just mentioned, of these new things that we're having to deal with, we have a lot on our plates, or the students when they're going out into the workforce. How do you balance all of that? How do you implement all the changes that are needed, knowing that the masses are going to be resistant to it. We like our status quo and so forth, but things are changing, and we have to think outside the box in regard to if we don't have the person because of workforce shortages, how can we be clever? How can we be more creative in regard to still getting the job done? Just because we don't have the workforce doesn't mean people are still not getting sick, that they're not going into the hospital, ambulatory, or nursing homes and so forth. So how do we do more with less? And I think this is where we really need to put a lot of emphasis, in our curriculums. How do we get the students to think outside the box and be clever and not worry so much about the technical skills?
I love this question. So, still the teacher, the organizational theorist in me likes frameworks, and so I think I agree with everything that Nancy has said. I would put these, I think, Ferhat, into three, at least three broad categories. One would be, I think, change because of advancements, and that's AI, machine learning, technology. I think that's something that we're all coping with, not only our students and our new graduates, but all of us as academics, as scholars, as healthcare professionals and practitioners. So I think that's one pot, and we're all faced with those challenges. I do think the question is for our bachelor's and master's and doctoral students, what do we emphasize? Because we can't teach them everything in that area. I think the second category is, again, related to what Nancy said, the influence of environment and society. And that would be, the what I like to now call the essential skills instead of the soft skills. And that's all the leadership and management skills and interpersonal skills. And there's a deficit there. It's clear. The data show it. We hear it constantly from the American Hospital Association, from the American College of Healthcare executives, from our colleagues in Canada. There was an effect of COVID and isolation on top of this huge move into everything virtual anyway, where we're together less of the time. And the students coming into the master's programs don't have the interpersonal skills that they had at one point. And I already saw that happening when I left academia in 2020. Students were having more mental health and behavioral issues, the economic highs and lows, the politics in the US and some other countries. I know you've experienced this in Turkey as well. And then I think the third category is also something Nancy mentioned, and that is the environment we're in, that volatile, uncertain, ambiguous environment where things are constantly changing. We have huge mergers happening here across systems, across organizations, vertical integration and horizontal integration. I really like that we focused in March at our workshop, our practitioner workshop. And then there's a seminar tomorrow that AUPHA is doing with ACHE and AHA for students and faculty primarily, but we're going to have almost 2,000 people show up for this webinar. And it's about critical thinking. And we've got a senior level executive, one of our colleagues, Justine Mischek at Minnesota, an academic and an administrative fellow who is fairly newly out of her program. And I like that triad. And they're going to be talking about the importance of critical thinking and decision making. You've got to be able to make decisions at every level. And I think that's something that our new graduates and our early careerists are challenged by. Yeah.
Those are really great answers. And I have a question. This is also a little bit personal. It takes me like a train ride or plane ride or somewhere like 5 minutes, 10 minutes to make a friend. But someone who's close to me, it takes like 2 years. So, and there is this difference between like, maybe it's because of personality, but also this generational difference is very important. So we have a lot of actual doctoral students who joined, and I want to mention Mustafa is here. He's the one who did the Herculean work on the paper you commissioned, Nancy. So I want you, with your wisdom, you and Dan, to give some advice to young generation about these things that they need to do. Like you're saying, okay, you need to improve these essential skills, but how they are going to do it? What are the practical advices that you can give it to them and they can just stick to it, maybe a couple of them, so they can improve themselves? What kind of advice you can give?
Okay. Well, the first thing which I say to my own children, and my children are in their 40s, and I'm still telling them this, okay? Put the phone down, okay? You don't need to have that in your hand all the time. Have conversations with people who are in the room with you, okay? Or seek them out. I also advise, especially with our PhD students, if you kind of remember I want to say the old days, where the PhD students would all come together in the lab, and they were with their mentor, they were walking the hallways, they were all talking with one another and sharing new information in regard to, oh, I just met with my mentor. You're not going to believe this new database that's available, or they told me about this or that or whatever. So there was a lot of peer-to-peer learning that was also going on during their doctoral education. I'm seeing now, working from home is so acceptable, that people are doing it for longer and longer periods of time. And I think, I'm sorry, maybe I'm old-fashioned, but I think, we need to come together as groups. We don't manufacture widgets, okay? We're talking about education in a very highly complex people industry, being healthcare. And we need to connect with each other. And technology is great. I use it all the time, of course, but it's really the relationships that you build. And one of the other things that I kind of mentioned, to our PhD students and so forth, is when they're trying to, do you mind if I kind of go down this path about research? Is that okay? Okay. Um, a lot of times, they'll be sitting there and let's brainstorm about, oh, what's my research project going to be? What is it that I should be doing for my dissertation and so forth? And they're coming up with, they're trying to figure this out themselves. And I keep on saying, when was the last time you sat down with a provider, a healthcare provider, and asked them, what are their problems? What keeps them up at night? We don't do research for our own convenience. We do research to solve problems. And you don't make up a problem just because you have data that you could analyze and come up with the results, okay? And I'm very blessed. I work with our what we refer to as our executive doctoral students. Okay, it was a program that Bob Hernandez really put together and led for us and so forth. So I'm very, very blessed that I get to work with these individuals who are leaders in health systems, across the gamut, as far as within the healthcare industry is concerned. And they're the ones who are also always keeping me up to date about this. These are the problems that I am most concerned with. These are my largest challenges, but nobody is doing any research in this area. No one is helping us come to an answer. So I always say to the PhD students, why aren't you talking to them? They're your customer, okay? They're the ones that you need to help solve their problem. So anyway, I know I kind of deviated there, but I wanted to make sure I got that in. And also for the PhD students who are attending, Dan alluded to this in the very beginning. AUPHA does have this doctoral track that we do. And we do it also at our annual meeting, which of course will be in San Diego in 2 weeks. And we strongly recommend or encourage that doctoral students submit research papers to that track. And there's, of course, we get first place, second, and third place. And the first, and all of those three papers, even though, of course, I always try and get the top paper into the journal, there's always room for the second and third place papers
That's
as
good.
well. So again, just come onto our website for the journal. It will tell you more information, but any of the doctoral students who would like more information about that, they can always email me. And Ferhat,
Yeah.
you can put my email address in the chat whenever you want to. Okay.
Well, I love the plugs. I love the plugs for
Of course.
for not only the journal but the
I'm a
annual meeting.
marketer at heart, right?
And we do have a doctoral program track. We also have a global track and or an international track and an undergraduate track. We try to do that because if we didn't, all the presentations would be about the master's programs
Mhm.
because that tends to be the foundation and that's the entry ticket into practice for the most part. Um, but our meeting's coming up in 2 weeks. But if you haven't been to an AUPHA meeting before, I think we'll have people from 5 out of the 7 continents. I know we've got colleagues coming in from Europe and Asia, and I think South America as well. We have programs now, academic programs on 5 of the 7 continents. I, I I'm a, I mean, you won't be surprised. I mean, I've probably sent 1,000 students to administrative fellowships over my 26 years being a program director. Um, and I've given out a lot of advice. And again, I like frameworks. And if I had the resources, um, I would put, and this, yes, a full disclosure, AUPHA has a corporate partnership with ACHE Learn. We have had a publishing partnership with them forever. But if I could, I'd put a copy of Carson Dye and Andy Garman's leadership book in the hands of every undergraduate senior and every entering master's students. I love the framework. It starts out first about knowing yourself, doing self-assessment, being self-aware, understanding the impact you have on people and they have on you. Um, a huge emphasis on mentors. Mentors are incredibly important, and you don't have to just have one. I mean, you could certainly have a mentor in terms of which fellowship or job you take. You should have mentors while you're in your, graduate and doctoral studies. Um, I would say understand your deficits. Whether it's Strengths Finders or some other type of assessment. Um, Objectively try to assess and ask others to assess as well. Um, and then I think, in terms of the outcome, I got great advice. Probably my first year or two out of Berkeley, it must have been 97 or 98 or so, way before I went to work for Peter Butler, who was the president and COO of Rush University Medical Center. He was a graduate of the program at Michigan. He eventually hired me away from St. Louis University to direct the health systems management program. And I heard Peter talking to an audience of students, and he said, the best way to have that next great job is to nail the job you've got right now. And oftentimes now I find that students are too much thinking about the next title and the next salary level and where they want to go next. And they've just gotten started in the job that they have. And I think you really have to pay attention to doing a bang up job and honing your competencies and gaining other competencies in the role that you have currently.
Mm-hmm. And network.
And network.
Yeah,
Relationship
I think
building.
that's also very,
Absolutely.
very important. And you can't, I mean, you can build your network within your own university, but really it's attending these conferences, whether it's AUPHA, whether it's the Academy of Management or URM and so forth. That's where you build your collaborations, and that's where you can brainstorm problems, across um, I mean, there's no boundaries at that point, So when we talk about what I would like to see even more and more of is more international collaboration going on, because even though we're different, we're more similar in our in the challenges that we have in our health systems. We're all trying to do more with less, less being dollars, less being people. Um, so, I mean, I think we really need to come together, and that's why, Farhad, I was so excited when I got your invitation about let's talk about this health administration education. What are our challenges? What are we teaching our students? Because again, I would have to say that 80% of our problems are the same.
Yeah, I 100% agree with you. So, I have a question, and that is also the question that Perihan asked. Many attendees today are joining from outside the United States, and you have already like answered some part, but I feel like the practical advice is not there yet. Like, how can international scholars and institutions become more engaged with AUPHA and Journal of Health Administration education activities and collaborations? How they can do that? I mean, can they join the webinar tomorrow? Like, how they can engage and get to know the resources better and participate, some advice that you can give.
Yeah, I think AUPH is very accessible. So our international membership rate, I'm not sure you'll find anything as affordable. Right. I mean, for $600 a year, 3 people can have access to everything from any department. Now, the U.S. and Canadian programs cannot do that. But outside of the U.S. and Canada, for $600, your program can name 3 people and they have access to everything that we have. Also, everything's open, whether you're a member or not. Now, you're going to pay a little bit more to come to our annual meeting if you're not a member. That's just fair to our members. I mean, they're the ones who keep us in business and keep us open. But we do have a membership category for everyone. We have an international membership category. We have an affiliate membership category. We have a developing program category. It's interesting. We've got 2 programs in Asia now that are full members. They came on as international members, but they wanted their bachelor's programs to be certified by AUPHA, and they put the resources forward to do that. I know we've got 1 program in Europe that's been an international member, and they want more access, and they'd like to be able to nominate their faculty for the AUPHA prizes and possibly serve on the board at some point. And that does require being a full member of AUPHA. So there's access points for all of this. But again, the primary emphasis, it has been and will stay on North America. It doesn't mean that we don't want to take over the world. It's like we don't need to take over the world. I'm very friendly with the executive director at Emma. I hope to go to one of their meetings sometimes. We keep scheduling our meetings at the same time, which is problematic. I would love to get to know the folks at SHAPE a little bit more. I've reached out to them on several occasions, but haven't heard back from them. So we're open and accessible. Now, what we're not going to do, because it doesn't make any sense, it's not logical. I have some of our members will occasionally ask me, when is AUPHA going to have its annual meeting in Europe? Well, no, we're not. I mean, our universities are struggling for finances. Our attendance in San Diego is going to be a little less than it was in Columbus because of airfare and hotel prices. Why would we hold our meeting? It's primarily for, our members and our academic programs in the U.S. and Canada. Why would we hold that someplace that's so hard to get to? So we're not going to be holding any meetings elsewhere. So we try to use common sense as well. Yeah.
Yeah.
And if I can, I'm sorry, Ferhat. You're on. Okay. And also, I was just going to mention before the journal, due to the generosity of AUPHA members, the journal is open access. So whether you're a member of AUPHA or not, you have, real-time, access to not just our current issue, but all the previous issues that we do have up on our website, which I think goes back maybe
2007.
I'm going to say, 20 years at least. Okay. So when we talk about, how can they get more involved there, kind of take a look at, what it is that we do publish, in our journal, where our interest is. And I have many international faculty members who will send me an email and just say, "Hey, listen, I'm working on this paper. Is this of interest?" And I have one right now in regard to professional education for nurses from some Italian colleagues that I have, and they just submitted that article. Okay. So, it doesn't have to be a collaboration with US and another country faculty. It can be, let's talk about, competency based in the Turkish system, because what do your competencies look like to our competencies? And like I said, I'll make you bet they're 85% the same because we're dealing with the same issues.
That's amazing. The other day, I had a conversation with Allison, and as part of her sabbatical, she's going to explore globally innovative educational approaches in the entire world,
It's cool.
and which is amazing. So, and as part of that, I said, Allison, let's put together a panel at the Turkish Academy of Management, which is, we have a deadline June 15. It's closing, so we need to put that panel together. And I wonder if Nancy or Dan, if you would be able to participate in this panel, because we're not holding a session there, but Dan, you have a session within HIMSS, for example. We have a AUPHA dedicated part where it's not a separate conference, but AUPHA is there. Can we embed AUPHA in also Turkish Academy of Management conference there, so students and faculty can have access, and also they can share their innovative practices about healthcare administration education? Do you think that's
I don't know. Again, first and foremost, why is that not Emma's role, Ferhat? I don't quite understand. Turkey is part of Europe, and so, so we could think about it, but we have to be able to pay for stuff. So I have that responsibility. So yes, we have an AUPHA forum at HIMSS. We have a practitioner workshop at the American College of Healthcare Executives, because we know we're going to have a lot of AUPHA members there. And we hope that we'll have enough to break even on the cost. I'll just tell you, Nancy knows we don't break even. And the board isn't going to launch anything else that doesn't break even. Given how finances are right now, we're all very worried. We froze dues for our members for this year because of the economy, because of what's happening in terms of federal legislation. We did the same thing during the pandemic. So we're very careful. It's sort of like it's like Steve Jobs said. I'm not a big fan of Steve Jobs in terms of his character, but I do like what he did in terms of business. And, I'm as proud as what we decide not to do is what we do. And we have a strategic plan, and the board makes decisions around those strategic plans. So, I can certainly think about coming to your meeting myself, but I have to come up with the money for that too. It's not budgeted. So, yeah.
Yeah, I understand that. And maybe we can come up with a solution, because that one is easier, because for example, our Turkish colleagues, because of the economy, it is a lot more for the difficult for them to come to our APHA meeting. Like, Savannah, Georgia is beautiful. I'm coming to that one for sure. It's not difficult for me, but for them to come to APHA it's not easy. So what we can do, maybe one or two people, we can go and have a session there. That's more conservative on the finances part, and I'll look into some arrangement for that one also. Maybe we can find some funding for that, hopefully outside AUPHA. That would be good. Yeah, so board will be happy. So Nancy, you mentioned about opening Journal of Health Administration Education to international, more international faculty. So far, the focus is more North America. how that can be practically done? Like, what are the steps? What are the creative ways that you're thinking potentially to for us to learn from also our colleagues outside the United States? As far as I know, this journal is the only journal on health administration education. Am I right?
That is correct.
So what are
that is correct. Well, you know, we're now that I'm coming into my second year as the editor, we're going to be doing themed issues going forward. And one of the themes that we have been kicking around is doing an international perspective. Okay. And I'm thinking of that for the latter part of 2027. So, you know, if we decide, because I'm talking with my associate editor, my assistant editor about this, then we would actually put out a call. And I would then say to, you know, all of my international colleagues that I have, spread the word. And how best to get this information out to others. You know, I'm also in a sweet spot because I'm the chair, you know, for the healthcare research management track, you know, for URAM. So when I do attend their meetings, I'm able to talk to a number of my international colleagues at that conference as well, you know, 30, 40 of them. And then, of course, you know, as my own colleagues at UAB, I mean, we do a lot of international work and collaboration. So I also use their networks as well to get the information out. And you know, and that's the best that we can do is do these type of webinars. So now people are now aware of it, you know, and this particular journal, you know, our particular journal. And then make it a pathway for them to say, okay, you know what? There is going to be this call. They want to know on an international basis, what are we doing as far as let's say competencies. Let's say it's going to be a focus on that. And so then they feel much more comfortable actually submitting something to the journal.
Well, I would add, there's one comment, I want to make sure that we don't get too far to the end without addressing AUPHA is not an accreditor. So there was a question in the chat about accreditation. AUPHA, along with ACHE and AHA and the American Public Health Association, founded the Commission on Accreditation of Healthcare Management Education, CAMI, in 1968 as a separate organization. It's always been separate. Always. It is today. They are doing some international accreditation. I think they've got at least one, maybe two programs in the Middle East that are now CAMI accredited. They've always done Canadian programs like we have. We recognize all the accreditors for our master's program. So if you're a master's program in the US or otherwise, and you're accredited by AACSB, which does all over the world, you're accredited by CEAF, which is the accreditor for public health, NASPA for public administration, or CAMI, your program can be a full master's program. So that's a change we made about 5 years ago. We recognize all of the specialized accreditors. And if your program in Europe has specialized accreditation, and I know we've got one program working on this right now, you know, you can be a full member of AUPHA. What AUPHA does do is undergraduate certification, and that's bachelor's programs. And those are really majors or majors with concentrations in them. And that's completely open. We have at least two, maybe three certified programs. We've got one in China, one in Taiwan. I know we've got a program in Japan that's working towards certification. So we do undergraduate certification. We don't do accreditation at AUPHA.
Dan, let me jump in there. I saw that question in the chat and was going to mention